Dr. Kahng, tell us all about sealants. Are they really a good thing? Do they prevent cavities? Who can wear them? Young people, old people? Should they be replaced, in young people? When should they be placed? All that type of thing.
Sealant usually we suggest for the young people. When the young people have the new permanent teeth, those teeth has lots of small pits and grooves on top of the tooth, and mostly cavities start from those areas. So we seal those deep groove and pits on the permanent molar teeth. It can prevent cavities. So young people, we highly suggest have the sealant.
How long do they last usually? A year, 2, 3, 5? Is it very, very different depending on the person?
Sealant it lasts few years, but it's not permanent feeling. So it lasts few years, and when the sealant wear off, it can seal again. So it's not a problem to keep the sealant in the mouth. So already regularly check up you can go to the dentist regularly, and then when the sealant wear off, your dentist can do the sealant again.
I see. And so you say elder people, let's say 25, 35, 40, upwards, whatever, they don't really need them anymore. Is that what you say? Or would they have a function of...
They can have it, but we don't recommend them much. We usually recommend about age 18 or 19, maybe it can be done. But over 20 years, we don't recommend them much because the tooth shape, it is a little change at that age. The grooves and the pit, those wear off, so it's not necessarily much. But the young age, about teenagers especially, they must have the sealant, so it can prevent the cavities.
So obviously, I mean, not obviously, but I guess obviously the sealants, they go mainly on the back teeth, which have a much larger surface, and the surface isn't all that flat, and it's, as we know, it's swinging and whatever. But what you call the groove, are some teeth having more groove like a rock? Some rocks are more flat and more smooth, and other ones are less smooth. Is that what's the case with the teeth? And if people have more grooves, they need the sealants a little more than other ones?
Yes. There are so many deep grooves and the pits for the young people, so that's the one.
And the groove is, let me see if I get that straight. The groove is big enough for maybe some part of food or infection or whatever it is to go in, and then from there create a cavity, but not big enough for the toothbrush, that thing to go in and clean it out.
That's right. The grooves pits, those are very narrow and deep, so many times the toothbrush cannot get in there. So sealant, it can close those groove and pits, and the toothbrush can clean up the top surface.
Got it. Well, all right. Here you have it. All about sealants. Kids should have them. I guess you prevent a root canal down the road. That's basically what it boils down to. A root canal, a crown, a bridge, an implant, and all that stuff. Is that basically what the point is?
That's right. So it can prevention. The sealant is a good thing. The sealant is it's not cost that much, and we don't have to drill the tooth. And most sealant gets no color, it's the same like the tooth color white. So it's cosmetically it's acceptable, and it's not that much expensive. So very cost effective, and we really recommend to use the sealant for everybody.
Well, I'm sure if anybody ever had a toothache, and if he can say that he just avoids one of those nights of a toothache for his kids, I'm almost sure that he'll go, I think I put my kids some sealants on. Thank you very much.
Thank you.